While doctors in parts of the U.S. are forced to turn some COVID-19 patients away because hospitals are just overflowing. Here, the Health Collaborative says hospitals have added hundreds of beds to accommodate the surge in cases this winter. WCPO 9 News reporter Courtney Francisco spoke to one of the top doctors on the front line in our city about the situation here.
The doctor I spoke to today is a pulmonologist at the Christ Hospital, one of those leading the intensive care unit in treating COVID-19. He described the situation inside as hospitals across the tri-state work to fight off an overflow of patients. Dr. Mark Scott says in his 20-year career here at the Christ Hospital, he typically signed 1 or 2 death certificates a week.
This week alone, I've signed 6.
He specializes in pulmonary critical care medicine and works with the sickest in the intensive care unit.
It can be devastating. And again, age doesn't necessarily protect you. Whether that's the quantity of exposure, the intensity of exposure, I don't know. But even young individuals can get desperately ill with this.
858 people are in the hospital in Southwest Ohio tonight. According to the Ohio Hospital Association, 177 of them are in the ICU. That's up 50% in the past 2 months.
A lot of hospitals have, because of the capacity issues, especially in the ICU and the intensive care units, have made the decision to postpone a lot of non-essential surgeries and procedures. And frankly, that's somebody that is not able to get care because there's been priorities established with trying to treat COVID.
88% of adult critical care beds are in use in our region, according to Health Collaborative nurse practitioner Tiffany Mattingly, and 83% of routine adult beds or med-surg beds are full.
That 80-90% includes hundreds of additional beds that our regions brought online within the hospitals.
Dr. Scott says he's not concerned with running out of equipment or space tonight, but staff are taking on more hours and responsibilities.
If you can do whatever it takes to minimize your personal risk, you should do that.
Coming up at 6 here, another reason not related to COVID-19. Dr. Scott says hospitals are seeing more patients. Reporting in Mount Auburn, Courtney Francisco, WCPO 9 News.